Awesome. Is it? Okay, I see. Hello, everyone. So welcome to today's APAC community call. So as usual, we for the agenda today, so we'll first go through the Odyssey news, and then we'll have three of our APAC study owners to share the quarterly updates on their studies. So with that, for the Odyssey news, of course, the next week or next weekend will be our first in-person APAC symposium that's gonna happen in Taipei, Taiwan. And if you have, I believe a lot of folks are going in person, so that's really exciting for the APAC community to actually meet in person. And also, I would like to share a quick good news today that we have not put in slides yet, but I'm just gonna share the paper itself. So let me do that now. Oh, I have three screens in front of me. I'm like trying to find the right one. Okay, so it's a very good news that the Coral Down study, which has been, we have had, Professor Ian Wong and Carmen and Wallace from Hong Kong U to share in, I think, the previous last year's symposium and also kind of the preliminary results we had back then. And now we're seeing the final fruit of all of the labor that we have spent during, I think, last 1.5 or 2 years. So it is officially published on the Journal of Annals of Internal Medicine, which has, the impact factor is a little bit over 50, which is like, I know, that's a lot of numbers. And also, I think it's a great paper from the APAC community working together. And also to give a shout out to everyone that's here, and also has we've been kind of involved in the APAC community to for all of this the efforts that people have spent on this study, and it is using 4 of IQVIA's OMOP data, and also to look at the comparative effectiveness of the different DOACs. So which I will so if you could put that in the link of the meeting now, so feel free to take a look. And just want to share this really good news because it was literally published like 2 days ago. So it's quite a good news for right on time for our community call to share with everyone. So that's for our Odyssey news for the day. And next we'll go into the actual kind of our main topic for the day, the APAC study quarterly updates. So we'll first have Professor Seng Chan You to present on the study update of the chapter study. So Chan, would you share from your side?
Yeah, I will.
Awesome, thank you.
No, it's not. I'm sorry. Just, I want to try. Yeah, this is a really brief update of chapter, the characterization of health by OHDSI APAC chapter to identify temporal effect of the pandemic. So until now, we've had several target databases, including Korean nationwide database, which is owned by HIRA. And for this purpose, we built a Docker image for the study, and the pilot package is now available. Again, if you want to join the study, you can define. You need to define your own cohorts for the specific medical conditions or visits, something. So there is a dedicated atlas. You can connect to the atlas. The address of the available atlas is website is here, and currently the pilot package for this study is available. So in this package, you can okay. So this is the package, and the Singaporean group with Easy and Bonnie actually are trying to executing this package, and we found several issues for for the reproducible environment. So that's why we've just added the REMV log files and the systems here. So I hope that some of you can also join the study to execute this package. So if you want to if you want to execute this package, please let me know, or you can just execute this package by yourself. But if you have any problem, please let me know. So this is the end of the update of today's call. How can I need to stop my sharing. So is there any questions, or yeah, is there any questions?
So Chen, I think in one of in a first slide you have, you mentioned the package is ready. Yes, this one. I think this one. Yeah. So it is like so you're testing like I'm just wondering like is that still like should the data partners start to run, or that's still kind
Oh
of
yeah,
you are testing it from your side,
yeah,
like either which
yeah.
one?
Uh, yeah. I think we will add several modules on this package, but you can execute this package. But again, this is not the final version, but you can try to execute one. But I know that IQVS database is so huge, so I don't want some trials on that database. That's why I'm
Um,
a little bit, yeah, I'm a little bit behind. But yeah, because the added modules will be kind of an ad hoc module, so you can just execute this package first, and then we will provide several ad hoc modules after executing this package. So yeah, please, if you can, please run this package against your databases. That will be really helpful. But
okay.
yeah, yeah,
Um,
and the other thing is that until now, we have only several cohorts definitions from Korea and Singapore. So,
mhm.
is there any other volunteers or study candidates? Then please let us know, and then you can add your cohorts definitions to this package.
Okay, and do you have a, I'm gonna ask a very PM question. Do you have a timeline of when we need to do this? Because it's end of the year,
Not
everyone,
really.
like I'm
Yeah,
just
yeah,
not
yeah,
speaking for everyone, but I was just wondering what's your expectation?
yeah. yeah.
Cool.
I think until this year would be wonderful. Within this
End of
year.
within this
Yeah,
year, because I was just
yeah.
thinking kind of like because essentially you're gonna put in a paper, so we don't want to like well just make it on time for
Mhm.
that. Okay, so I'm gonna write it down. So Chen, and I think for I because for the first round or what we did for the chapter study back in the EU symposium, so because I shared the like from IQVIA side, we have the phenotype February cohort
Mm,
diagnostic tool results, which we shared. And I think you were
mhm.
using, like we used that one for the previous
Indeed.
studies, but
Yeah.
any database of interest? Because that was like, I think we just sent you like all we have available.
Yeah, I don't have any specific database in my mind, but uh, and and we add several different cohorts from the February uh, phenotype February thing. So we added several different cohorts on this, and yep, I don't want to limit the database only for APEC regions. So we
Mm.
we can extend the scope of the study to beyond the APEC, even though it is led by APEC community.
Okay, and then Jen just wondering like how like the phenotype February, I think that runs through for a really long time because our data is so huge. But at this one,
Right.
do we expect this thing to run very long time?
Yep, I think, but yeah, February phenotype has really large, really many course
There are
definition,
like
which
80 something cohorts, but this one
in,
it's
in here, like we do have eight, yeah, eight courses maybe, so much less.
okay. Sounds good. Cool.
Okay, great. Is there any other comments or questions? Yep. Again, if you can run this package, please try to run this package against your databases, and then let me know. Thanks.
Thank you, Professor Chan. And next, and if you have any questions, of course, always reach out, so that we'll see how we can help. So next we'll have Ian from Hong Kong U to give us study updates on the AKISO study. So Ivan, do you want to share your screen?
Yeah, sure. Just one moment.
Okay.
So guys, hi, Song here. While we are waiting for Ivan to share his screen, I just wanted to let you know the APAC Symposium, the tutorials, the tickets are almost sold out. I think there's like 9 or 10 left. So if you want to if you want to be learn something at the tutorials, you need to register. So please, before it's sold out, you should definitely register for the tutorials. There are some tickets left for the main conference as well. So please, if you are going to do it but you don't have the time to do it, now is the time to do it because the event is now like less than a week, almost a little more than a week away. So please go ahead and register. Hope to see you guys all in person. I will be there. Jing won't be there, I think, but yeah, yeah, I will see you guys in person next week. Yeah, all for me. Thanks.
Okay. Thank you, Sung and Jing, for the introduction. Yeah. So today I just want to talk you through some of the work we've been focusing on our OHDSI APAC study number 2. On the comparison of mortality, morbidities, and healthcare resources utilization between patient with and without COVID. So yeah, since we last caught up with the APAC community, we have been focusing on several aspects, and here are the summaries of what we've been working on. So in terms of these study package development, we have developed the initial package with the help from IQVIA. So at the moment, we are doing some tweaking, adding some additional content, and also testing the package within our team using our own Hong Kong Hospital Authority database. And in addition, from the package from IQVIA, we also received some preliminary data on 2 of their databases. So they are the France and the Italy databases. And we also obtained some results by running the package on our own Hong Kong HA database. So, and thirdly, as I mentioned before, we are doing some fine tuning to the package. And once that's ready, then we will go ahead to perform the data analysis for our pilot study. So here is a brief reminder of the study design of our pilot study. So the pilot study will have a shorter inclusion and follow-up period to our main study, and we will be comparing patient with a diagnosis or a positive screening test for COVID-19 to those who do not, and we will monitor for any short-term and medium-term adverse outcome in this study. And here are some of the preliminary data that we have received, and we've managed to obtain. So here is a flowchart to show how we recruit, how many patients we've recruited into our preliminary analysis. So using the France database as an example, we identified over 66,000 patients who met the definition of a COVID-19 patient, and just under 3 million control patient. We exclude those with prior adverse outcome, those with less than 1 day at risk, and those who cannot be matched to a comparator or a target patient using propensity score matching. So in the end, we were able to include over 52,000 patients with COVID-19 and over 366,000 comparator into their respective cohorts from this database. We applied the same inclusion and exclusion criteria to to other databases. So this is the numbers and the flowchart from the Italy database, and also our own Hong Kong Hospital Authority datasets. So in total, we have included over just under 70,000 patients into the target cohort, and that accounts for about 58,000 person years of follow-up time. And for the comparator cohort, we have over 490,000 patients with a follow-up time of over 391,000 person years of follow-up time. So yeah, here are the results from our analysis. So looking at the hazard ratio for these neurological adverse outcome, we did not observe any significant risk difference in these neurological adverse outcome. However, for these cardiovascular and hematologic outcome, we did observe almost around a threefold increase in risk of myocarditis, pericarditis, pulmonary embolism, immune and idiopathic thrombocytopenia, and also about 50% increase in risk of myocardial infarction amongst patients with COVID-19. So although these preliminary results did indicate an increased risk of these adverse outcomes, we don't wish to draw any conclusion at this stage, as we are still early on in our data analysis process. So for our upcoming plans, we will finalize the details for our study package and to build up the final version. We are exploring the possibility of doing subgroup analysis by stratifying patient by age group and sex. And once the final package is ready, then we will begin the data analysis for the data analysis for our pilot study. And with that, that will be the end of my presentation. Thank you very much for listening, and please feel free to let me know if you have any questions or comments. Thank you.
Cool. Thank you, Ivan. Any questions or comments from the audience? Then stay tuned.
Yeah, thank you. Thank you for listening.
Okay, cool. All right. So with that, thank you so much, Ivan. So next we'll have Chungsoo here to share the study updates on the data quality study.
Okay. You guys see my screen now? Or oh, you can.
Yeah.
Yeah.
I can see the screen. Yep.
Okay. Today I would like to present the CDM inspection study update briefly. And yeah, we are doing this study for assessing the current status of CDMs in APAC region. So we are collecting the CDM inspection reports from the study site. And the study package was already disseminated, and we are still in collecting the results. We have done receiving 25 results from South Korea, China, and Japan. And lately, we have got 2 more results from the Yonsei University Hospital and in Korea, and the KTPH database result of Singapore. But yeah, it needs to revised. But after quality check, those are included into the final result. And so we now have 27 results. Thank you again for collaboration. And I also heard that the Taiwanese folks have some struggles with this package. So please feel free to contact me, and maybe we can discuss about this project in person at the symposium. So yeah, this is the preliminary results, the same as the previous presentation. So we found that 36 billion records of data were in our database of APAC region. So this result will be updated, including the latest results for presenting next week's symposium. And during this analysis, we plotted the data records as the stack bar plots. So we found some unique proportions of some institutions. So we requested the detailed description for this, and we have communicated with those sites. And yeah, for example, one database has large proportion of observation tables. So we communicated with the team of that organization, and then we found that they have a default code which have no meaning in their EMR system. So we that was included into their observation table. So they have weird proportion of this between the data table. So we give a comment to them. They need to fix this code. So this is quite interesting example. And we also finalizing the reference according to the type of data and type of institution and so on. So maybe these are also updated until the next week. So yeah, this is our plan. So we some organization request to us they want to update their reports. So the reports updates is ongoing, and there are many issues of the package, because we have very different environment in each organization. So we are ongoing the issue debugging, and we have to discuss for the quality metric also, and we have a plan to present these results at the OHDSI APAC symposium. So we especially I have to finalize this result and make a slide, and I think we can finalize this study until this year, and we have to make a publication strategy for especially how can we finalize this result, and how to make this result to the publication. So yeah, these are brief updates of study 4. Thank you for listening.
Oh, thank you. Thank you, Chungsoo. Any questions from the audience? So Chungsoo, I know you're still waiting for 2 more data results, right? 2 more?
I already got the result, but
Oh,
I
okay.
had to revise them because yeah, they have some error in the report.
Okay, so and after that, then are we gonna go for, the full paper and all of that? Is that the plan, or are we still waiting for more?
I think we can include the result until this year.
Okay.
Yeah, especially I want to include the Taiwan and maybe more Australian data, I think. So yeah, so maybe I can include the results until this year.
Got it. Cool. Any other questions asked from the audience? All right, I'll take that as the no. But thank you so much, Chungsoo, for sharing the update. So that's all of the 3 APAC study updates that we have for today. And so Nicole is not able to present, but we'll kind of be looking forward for her update in the symposium as well. So I think that's all for today's community call. And of course, all of the recordings and materials will be uploaded to ohdsi.org/APAC. All right, thank you, everyone. And I think most of us or some of us will meet in Taiwan next week, and we'll see everyone soon. Thank you.
Bye, guys.
Bye.
Thank you.